Welcome back. Let's discuss abdominal pain and bloating. Obviously, these are super annoying symptoms, and what I'm hoping to provide you today is a little bit more of a deeper dive into what's causing the bloating and pain so that you can repair the cause and not have to resort to palliative anti-bloat medications or diets that require you to restrict a lot of foods. Not to get too deep too quick, but bloating is not consolidated to the gut. It really crosses three systems and pain: the gut, the immune system, and the nervous system. And that's what you're seeing here. You're seeing the lining of the gut, the microbiota or the world of bacteria, and how this interfaces directly with the immune system, mast cells, histamine, a number of inflammatory cytokines, which is sort of the language that the immune system speaks, and as you see here, afferent and efferent neurons. So we'll unpack this. I know this image might seem a little bit busy, but it provides us with these very important points of understanding that bloating has to be addressed across all three of these systems. And that's how we can achieve long-lasting resolution that will allow you to expand your diet and not, again, resort to or have to resort to these highly avoidant diets or using things like Gas X or whatever to sort of quell the pain when it does pop up. If you're new here, welcome. I'm Michael Ruscio, a doctor in clinical practice. I also work as an adjunct professor and as a clinical researcher with a few papers published in scientific journals and a few more on the way. Okay, so to start our conversation, I think the first domino here that probably falls within the gut is the shrinking exposure that we have modern day to healthy bacteria. Of course, antibiotic use is not helping. Ultra-processed foods definitely has a deleterious effect on the good bacteria. Modern sanitation also takes us away from how we used to live close to the dirt, close to animals. And another interesting data point here is that before the advent of refrigeration in the 1930s, virtually all cultures around the world routinely consumed fermented foods that were preserved with bacteria. This was sort of one of the first ways in which we could improve the shelf life in a healthy way of foods by fermenting them. And when we ferment, we have a lot of obviously bacteria and probiotics. To double click and go a little bit deeper in the gut, the end of the intestinal tract, the large intestine, has a lot of bacteria. This is right next to the rectum at the end of the line. It's short, it's wide, and bacterial rich. The small intestine is longer, it's quite thin, and it shouldn't have a lot of bacteria in it. But we have lost bacterial balance. People tend to not have enough bacteria in the large intestine and too much in the small intestine. And why that's so important is because the small intestine, again, being long and very thin, it can't accommodate the gas pressure or the gas in general that's released by your healthy intestinal bacteria when they process food. So this truly is a situation of bacterial imbalances, not enough bacteria in the large intestine and then too much in the small intestine will lead to something like an apple or broccoli, garlic, onions, avocado, seemingly healthy foods to cause this feeling of bloating, distension, pain, and pressure because that long, thin, small intestine can't accommodate the gas. The other really important thing here that happens is the small intestine is where over 90% of calories and nutrients are absorbed. When the bacteria overgrow, they actually reduce the absorption of these nutrients. And not only that, but when we lose bacterial balance, have too much in the small intestine, a condition known as SIBO or small intestinal bacterial overgrowth, these bacteria can start to produce other metabolites, one of which is called D-lactate. And this is why some people may notice they have correspondent bloating and pain along with brain fog or mental fatigue. Also, the bacteria, when they overgrow in the small intestine, they reduce the ability of bile, which is made in the liver, stored in the gallbladder, and assists in fat digestion. That function is deterred, and this can actually lead to diarrhea. In fact, and not to get too graphic here, some people have probably noticed that when they have loose bowels, that they tend to float. And that is because in some cases, the fat is not absorbed because the bile is not working and fat in water floats. And while all this is happening, it's irritating the lining of the gut and leading to leaky gut. To put one data point up on the board here, a 2020 meta-analysis found that up to 40% of irritable bowel patients, so just sensitive digestion essentially, had confirmed small intestinal bacterial overgrowth. And many of these people went undiagnosed for years. And by the way, if this is helpful, please comment and subscribe. This really provides very necessary support for our channel to reach and help other people. Okay, so we've discussed this epidemic of abscess, this bacterial imbalance in the gut. Let's talk more about how this then triggers the immune system. And coming back to our diagram here, on the other side of the intestinal tract is waiting the immune system. In fact, the largest density of immune cells in the entire body is in the small intestine. It's about 70% of the immune cells in the body are there in that small intestine, that crucially important, long, thin, absorptive membrane. But there's also underneath that surface a key cell called a mast cell. And this is one of the chief regulators of the immune response. When we don't have healthy bacteria and we have damage to the lining of the gut, particles leak through, known as leaky gut. This triggers the immune system, most namely, but not limited to, the mast cells. And the mast cells, being immune cells, they speak a signaling language of inflammation. And that's what you're seeing here. All these interleukins, these cytokines, are various ways that the immune system, through inflammation, starts trying to clean up that mess. But this inflammation makes you more sensitive to pain, and it also has a deleterious effect on the gut. Also, as you see here, that mast cell also interfaces with afferent, meaning going up to the brain, and efferent, meaning signaling downward to the gut, neurons. So again, the phenomena of bloating and pain crosses three different systems. So the final system then is the nervous system. Just to put another data point on the board here, 2023 review paper from the journal Gastroenterology, quoting approximately 4 out of every 10 US adults has DGBI, disordered gut-brain interaction. So it's well established that this is not an uncommon phenomena, and it's actually this DGBI, it's the new name for irritable bowel syndrome because the neurological or the brain-based component is so important. Now, again, we discussed the afferent upward and the efferent fibers. What's interesting here is that 80% of the fibers, of those nerve fibers, travel from the gut up to the brain. This is mainly facilitated through what's known as the vagus nerve. This signal transitions to this nucleus called the nucleus solitarius, and it's then broadcast to deep brain centers like the amygdala, which is central for fear and emotional processing. And so this is part of how people might have things like anxiousness or even a low mood when they have a problem in the gut, because there's truly a connection between the gut and, again, these deep parts of the brain, like the amygdala, part of the limbic system. Now, there's a few other things that break down here. And by the way, these are all very able to be remedied, but I want to kind of walk you through the rationale behind the recommendations that we're working our way toward. One of the things that's really problematic modern day is that inflammation is actually very stimulating to the fight or flight nervous system. So within the autonomic nervous system that functions things like digestion, you can push one of two ways: sympathetic, fight or flight, or parasympathetic, rest and digest. Now, obviously, as the name implies, you want to be parasympathetic so you can rest and digest, so food can move through at the appropriate pace. And also, as part of that rest, there's signaling via the vagus nerve. This is now going downward where acetylcholine is released, and that has a very powerful anti-inflammatory effect. When the feedback loop is working correctly, you have healthy gut function, you have healthy immune function, healthy nerve signaling up to the brain, and then you have a healthy downward signal of food moving through the intestinal tract and also that acetylcholinergic anti-inflammatory signal. If we have the cycle functioning in the correct direction, it helps food move, it reduces inflammation, and it reduces pain. Or conversely, it slows food down, or in some cases speed foods up, propagates inflammation, and amplifies pain. Okay, so now we've sort of outlined this cycle and the systems therein. The epidemic of absence of good bacteria, how this causes bacterial imbalances, too little in the large intestine, too much in the small intestine, how this leads to leaky gut and immune cell misfiring, and how all of this is received and transmitted from the gut to the brain and then back down to the gut. So what can we do to start moving things into the direction that we want to be? The first, obvious, is food. Now, I said a moment ago that I don't want to provide you with sort of, avoid these trigger foods, do that forever. And that's not what we're going to do. But there is a diet that can quite effectively interrupt some of this process that we're trying to stop. And this is known as a low FODMAP diet. This is a diet that will reduce the foodstuffs that feed the bacteria, and very importantly, does so in a corrective fashion. I'll give you the evidence, the clinical studies that have demonstrated this in 1 second, but FODMAPs stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, different structures of carbohydrate that can feed vigorously bacteria, which under normal circumstances is not a problem. But when there's that high degree of bacteria in the small intestine, that bacterial imbalance, then they become problematic. And this is part of the reason why some people will say, I ate a healthy meal, yet I still have bloating and pain. So the low FODMAP diet reduces foods high in bacterial feeding compounds, thus starves the bacteria and brings these levels back to balance. But the nice thing about this diet is it also reduces inflammation, calming the immune system, and seems to have a reparative effect on the nervous system, which is really exciting. So one, I think, really compelling data point here comes from the journal Gut. It was a meta-analysis. So this is going to provide us with an overview of what the randomized control trials have found. And what they did find was that when the low FODMAP diet was compared to normal IBS diet advice, the low FODMAP diet was actually the best for abdominal pain, bloating, and modulating or correcting bowel regularity. So if people had diarrhea, it helps make them less diarrheal. And if they have constipation, it helps make them more regular. Okay, so I had said a moment ago that there's also this calming effect on the immune system. And a few trials have found that low FODMAP dieting actually reduces levels of histamine and also other similar molecules released by the mast cell called tryptase after just 4 weeks on the low FODMAP diet, suggesting that it's sort of reparative. In fact, another data point that I still find so phenomenal, Tarek Mazawi, Dr. Tarek Mazawi, I should say, was on the podcast. Gosh, now this is going over 5 years back. But what he and his research group found is shown in this slide. So what they wanted to do was better understand what's happening in the intestinal tract that's allowing the beneficial symptomatic effects that we observe. So they looked at healthy controls, and they actually took biopsies from the intestinal tissue from these healthy controls versus another group of people with ongoing IBS, so food reactivity, bloating, pain, diarrhea, or constipation. They took a sample on day 0, technically, and then after a month on the low FODMAP diet. And what they found was very interesting, that in the intestinal cells, the enterocytes, after the low FODMAP diet, people actually had more serotonin producing cells in the lining of their gut. So truly, there seems to be a reparative and regenerative effect because serotonin is a very important signaling molecule of the immune system. And so, if all of this is true, then we should see the low FODMAP diet have this reparative function insofar as it allows people to reintroduce foods that they couldn't eat before and now tolerate them. And yes, that's exactly what we see from a 2023 survey study. They found that over 50% of the foods that were cut out could be reintroduced successfully after only approximately a month on the diet. So that's not perfect, but it is very suggestive that the low FODMAP diet takes a big step in the direction of improving food tolerance because of all these aforementioned effects. I will link to a full version of the low FODMAP diet in the description, but let's just go through a few of the high points regarding what foods are high FODMAP and should be avoided temporarily, and what other foods you can focus on instead. What this would look like, in short, again, look at the full list for a more comprehensive guide. Looking at grains, you'd want to avoid high FODMAP foods like wheat, barley, and rye, but you can consume oats, quinoa, and brown rice. Regarding vegetables, avoid broccoli, cauliflower, asparagus, garlic, onions, avocado, and swap those in temporarily for kale, spinach, carrots, cucumbers, green beans, and zucchini. Regarding fruits, avoid apples, grapes, plums, watermelon, and peaches, and opt for blueberries, raspberries, cantaloupe, oranges, and strawberries. And then finally, regarding dairy, sans on the cow's milk, but replace with either a lactose-free milk or yogurt, or rice milk or hard cheeses. And the other thing here I want to point to is, hopefully anyway, inspiring for people in the sense that intolerance to grains and to dairy might be able to be recovered, because it does appear that this FODMAP intolerance is more common than a true allergy to dairy or to wheat. Both exist, but the encouraging thing about the low FODMAP, or I'm sorry, the FODMAP intolerance is that's repairable. So if you have noticed that you don't do well on wheat or dairy, you may be able to consume this again if what's underlying that is the FODMAP intolerance. And then a few points on the low FODMAP, how long to do it. Do it for about 4 to 6 weeks and then start to reintroduce. Think about this like a rehab plan, where if you injured your shoulder, you would avoid certain activities and focus on rehab for about a month, and then gradually resume activity, listening to your body along the way so as to know how hard to go in the gym or with exercise, how quickly. And then the other thing I just want to make sure to mention is this doesn't have to be 100%. 80% compliance is enough to reap all these benefits. So if you have a dinner or you're traveling, give yourself some grace. That will not be the difference between success or failure on this diet. Now, there are some cases where people may notice, literally or seemingly so, everything they eat elicits a negative reaction. An option for these people, I'm not saying it's the only option, but a good option is an elemental diet. This is essentially a meal replacement, but with the important caveat that this has been formulated very specifically to have zero FODMAPs and to be very easy to digest and also simultaneously hypoallergenic. And what this is able to do is help to reset that bacterial overgrowth, the resultant inflammation, immune system signaling, and nervous system amplification. In fact, research over at Cedars-Sinai with Mark Pimentel has demonstrated that using the elemental diet can lead to a 85% resolution rate of that small intestinal bacterial overgrowth. Other data are very promising using the elemental diet for inflammatory bowel disease. So if there's Crohn's or ulcerative colitis, and even one study found that in the autoimmune inflammatory condition of the joints, rheumatoid arthritis, the elemental diet was as effective as steroids. So how to use this? Again, links with more robust instructions in the description. What we recommend is a 2 to 4 day reset where you use mostly or exclusively these meal replacement shakes. And then from there, you replace 1 or 2 meals per day for a period of a few weeks and gradually resume normal food intake. Again, kind of following that rehab plan analogy. And this is something we have seen some very nice case reports where people have noticed, as in Christy's case here, fairly remarkable improvements in their health by using the elemental diet. Now, we've also discussed, of course, the pivotal impact that leaky gut and the immune system has in this whole cascade effect. This is where probiotics come in. Probiotics will impact all three systems, but where I think they are misunderstood or underappreciated is regarding their impact on inflammation and on the immune system. One of the things that probiotics will do is they will modulate certain receptors like toll-like receptor 4 that governs leaky gut. And leaky gut is sort of the first domino in that cascade of leaky gut, immune system reactivity, inflammation, and the nervous system. Outside of the toll-like receptor 4, there's another very important upstream immune cell called T regulatory cells that probiotics also modulate. And these, as the name sort of implies, T cell regulatory cells, they impact the level of immune system reactivity to things like food. So this is probably why we see pretty impressive data like a meta-analysis documenting that probiotics can ameliorate leaky gut, that probiotics can resolve SIBO, fungal overgrowth, they can reduce histamine and histamine-mediated conditions, and also help correct bowel regularity, meaning those with diarrhea have less frequent bowels, and those with constipation have more frequent bowels. Now, we'll also include more resources for you regarding a probiotic protocol. We essentially use the heuristic of there are 3 general probiotic formula types, blends of lactobacillus and bifidobacterium. Conversely, a Saccharomyces probiotic, which is a healthy fungus, and conversely again, a soil-based or spore-forming probiotic. These can be used independently or altogether. The lactobacillus and bifidobacterium are used at a dose of 1 to 50 billion CFU per day, the Saccharomyces between 4 to 15 billion per day, and the soil-based between 2 and 6 billion per day. And something that we've been experimenting with in the clinic, this has not been published yet, but we're hoping to publish on it at some point, is using all 3 of these probiotics together, an approach that we've termed triple therapy probiotic, does seem to be, in some cases, more effective or effective when one probiotic alone hasn't been sufficient. And I wanted to ask Dr. Jake from our clinic to share a recent case study, just as one of many a case in point where for some people, this sort of stronger triple therapy approach moves the needle.
Yeah, this was an interesting case where a middle-aged female came to the clinic with abdominal pain and bloating, and her symptoms had been previously unresponsive to the therapies she had tried. These included antibiotics for SIBO, probiotics, and digestive enzymes. And the digestive enzymes actually provided some relief, but she had become totally dependent on taking them with every single meal. And after 2 weeks on triple therapy probiotics, she actually reported a 90% reduction in her bloating, complete resolution of her abdominal pain, and she was able to completely discontinue the digestive enzyme supplements. So likely what happened here is the probiotics resolved any overgrown or imbalanced bacteria in her intestinal tract while simultaneously reducing inflammation. And that then was able to restore her body's own endogenous digestive enzyme production.
Now, the protocol here is to use for a minimum duration of 2 to 3 months. I used to say for a month. Let me clarify sort of some of what I mean here. You should have a signal within a month, but people may need 2 to up to 3 months. And here's one of the data points that sort of swayed me to increase the recommended duration of a probiotic trial. In this study, they looked at patients who had irritable bowel, which is hallmarked by abdominal pain, bloating, and bowel irregularity. They gave them a probiotic. And what they found was that, unsurprisingly, they had less bloating, less pain, better bowels, also better mood and better sleep. But here's the really interesting component of this. In this graph, they tracked cortisol levels. Now, it's healthy to have robust cortisol release in the morning because this is what gets you up, gets you out of bed. You don't want to have high cortisol at night, but you do want to have relatively high cortisol in the morning. When people have chronic inflammation, they tend to have low morning cortisol. This is one of the reasons why people feel fatigued. Here's what's so fascinating about this study. At baseline, so before any intervention, these individuals had, as you would expect, low baseline cortisol, low morning cortisol at baseline. At week 4 and week 8, they had a normalization of their cortisol. So not only did they have better energy, but they also had better sleep, which is probably because people had a correction of the day-night cortisol rhythm with robust cortisol in the morning and low cortisol at night. When that inverts, people can sort of cruelly have low cortisol in the morning, they're tired, high cortisol at night, they can't sleep. This was all corrected, but here's the key thing. When they stopped taking the probiotic after 8 weeks, 2 months, they started to see their cortisol levels go back to that abnormally low morning level, telling me that at least some people may need a longer duration of the probiotic to help unwind this entire cascade of firstly fighting SIBO, which probiotics do, and we'll come to data on that in a moment, but also healing leaky gut, reducing inflammation. And then this is actually a beautiful evidence point for how the probiotics have an effect in the brain, because it's the brain that tells the adrenals to make cortisol. So literally what happened here was the probiotics in the gut sent a signal to the brain, and this is probably actually right next to that amygdala we mentioned earlier, another brain center called the hypothalamus. The hypothalamus is what controls much of our hormone release. That had a positive corrective impact on cortisol levels. So I wouldn't say the case here is fully made scientifically regarding 2 months, but the one point I would want you to take away is if you use a probiotic for 2 months and then stop and say, well, it worked for a while and then it didn't work any longer, you may just need a longer course. So for some people, they may have and they may be experiencing symptoms that are somewhat chronic. And maybe they've even done something like rifaximin, which is an antibiotic which can treat SIBO, or used natural agents like garlic or berberine, which can also treat SIBO, experienced some improvement, but then regressed. What can be happening in these cases is the bacteria, in this case, the small intestinal bacterial overgrowth bacteria, can actually embed themselves in the lining of the gut and form a protective coating around them known as a biofilm. In fact, one study that did an endoscopic examination, so this is the tube down the throat to assess the small intestine, they actually had visual evidence of biofilms in 57% of patients with IBS. That's what you're seeing here. On the left, you are seeing this sort of lumpy, clumpy white film. That is the biofilm. And on the right side of this image, you're seeing just sort of this smooth intestinal lining photo with none of that film. So this is what underlies some chronic and resistant cases. And I'm very happy to say that we currently have a paper in peer review that has looked at how can we treat these biofilms. And so what we did in this study, which again is in peer review and hopefully soon it will actually be published in a journal, we gave half of the individuals a herbal anti-SIBO treatment. The other half got the same thing plus an antibiofilm agent. And we were able to document, I think for the first time ever, that the co-administration of the antibiofilm agents actually lowered SIBO gas levels better than just the herbal antimicrobials alone. Now, these agents essentially combine protein digesting and carbohydrate digesting and also mineral binding components that help literally pull apart this biofilm. Because one of the things that I didn't mention, I probably should, is that when there is this biofilm, it has been documented that you need 100 to 1,000 times the level of whatever you're using to kill the organism, because that biofilm protects the the colony, in this case the bacteria, from treatment. So when you use these agents to open up that biofilm, you can have better long-term resolution of, in this case, the underlying small intestinal bacterial overgrowth. Okay, so in order to address a biofilm, we need two things. One, agents that kill, and two, agents that open up that biofilm. In the clinic, and also what we're hopefully soon publishing on, we used killing agents from the Biota Clear series. There's 4 agents therein, 2 used for the first month, 2 different ones used for the second month. And we paired that with the antibiofilm agent called Biota Dissolve. We will link to further details in the description of this video. That takes us through some dietary strategies, low FODMAP, the elemental diet in select cases who need a little bit more calming, the probiotics that are going to have a very strong impact on multiple components of this cascade, and then using agents that break down biofilm, especially if you've noticed that your symptoms respond a little bit and then they always come back. So it's a lot, right? But there's one final component here that I want to share, which is especially for those who notice stress is a big trigger. This would be a brain-directed therapy as the final component to consider. We said earlier that inflammation is triggering or stimulating to that sympathetic fight or flight part of the autonomic nervous system. One of the things that happens when inflammation is chronic is it can actually start to skew those deeper brain centers like the amygdala and hippocampus, the centers in the limbic system, to become more locked in this fight or flight swing of that pendulum and not allow the individual to swing back to parasympathetic rest and recover. So it's really important to state that foundational lifestyle practices are key here. Exercise, sleep, time in nature, also known as Shinrin Yoku or forest bathing, meditation, prayer, cold water exposure, music, dancing, laughter, singing. These things are all very important, and I would advise to do those as much as you can, of course. But there's a device for people who may be doing those things or may have a hard time doing those things. There's a device that can simplify and provide an additional level of stimulus to that parasympathetic part of the nervous system. This is known as auricular or ear vagal nerve stimulation. A headphone, a specialized headphone that creates a low-level electrical impulse, sort of a buzzing in your ear that stimulates the vagus nerve, and that's going to have a retraining effect on the amygdala and also all this downstream benefit that we want. Now, what really sort of swayed me here regarding the viability of this therapy was a 2024 clinical trial. They took 40 patients with IBS. Half of them were given a sham, meaning it looked like the treatment, but it actually wasn't. And the other half were given the actual auricular vagal nerve stimulation for 30 minutes, once per day for 1 month. At the end of that 30 days, they demonstrated only in the group getting the treatment improved abdominal pain and bloating, a balancing of healthy bacteria levels, increased acetylcholine, like we discussed earlier, improved vagal tone, as you would expect because those two go hand in hand, improved bowel regularity, and reduced anxiety and depression. The device is called VaguStim, and there are other devices on the market. This one we found to be the most in keeping with what the majority of the research studies have used. And again, you can use this for about 30 minutes, 1 to 2 times per day. And this is going to have a gradual effect on retraining the nervous system not to be so sympathetic and allow you to be parasympathetic, rest, digest, acetylcholine, anti-inflammatory, pro-motility, a lot of good things when we get this balance right. No supplement for time in nature, sleep, meditation, but rather a complement to those factors. In close, I found this to be a relevant thought. Diseases are more properly seen as symptomatic expressions of deeper underlying imbalances. And so in this case, hopefully you now appreciate those imbalances in the gut, the immune system, and the nervous system, and how they can be addressed. These therapies will not, all of these therapies will be needed by all people. but this provides a starting point for experimentation or discussion with your healthcare provider. A few things to consider. If you look at the low FODMAP diet handout, there's a list of foods to include and to avoid. If you're saying, boy, I'm eating a lot of the avoid foods, that gives you an obvious signal that, hey, this might be a good idea for you. If you're not regularly consuming fermented foods, which are rich in probiotics, or not using a probiotic supplement, then that might mean there's a viable opportunity for you. If you've noticed that various agents that kill bacteria help for a little while, but you regress, biofilm support may be needed. If stress is a trigger, then the vagal nerve stimulation may be needed. Just a few thoughts. And also that the more severe and the more long-standing the bloating is, the more of these therapeutic options you might want to consider. Also, layering over time is fine. This way you can go kind of slow and steady. And again, always check these things with your healthcare provider. And if you do get stuck, feel free to reach out to us at the clinic. This is what we love to do. And again, hopefully this gives you some direction so that you can, in a long-term fashion, resolve the bloating, resolve the abdominal pain, and also, perhaps most importantly, improve your food tolerance so you can be devoid of symptoms while simultaneously be on a broad diet and not have to worry about what you're eating. Alrighty, this is Dr. Michael Ruscio. Hope this helps, and I will talk to you next time.